Hello, my name is Dr. Sourav Das. I'm a consultant psychiatrist with Somnos Sleep Clinic. I'm also attached as a visiting consultant with Medica Super Speciality Hospital Kolkata and Iris Multi Speciality Hospital Kolkata. I work as a consultant psychiatrist dealing with various kinds of patients, including those suffering from schizophrenia. And I do deal with general adult psychiatry, particularly those who have various kinds of psychotic disorders and addictive disorders in my routine clinical practice. Today's topic is about schizophrenia. It is an umbrella term actually. There are many different symptomatologies and different diseases which can be covered under the diagnosis of schizophrenia. Schizophrenia itself is a type of psychosis or a type of psychotic disorder. Now we have to know what is a psychotic disorder. Psychotic disorder means that a disorder in which the person loses his or her touch with reality, like things appear, like unreal things appear very real to him or her, and that is the core feature of a psychotic disorder. It can be of various types. Schizophrenia is one of them. In fact, schizophrenia is the most significant and most complicated, as well as the disease with most amount of morbidity and mortality among all the psychotic disorders. So when we are discussing about schizophrenia or what is schizophrenia, we have to understand that there are it can present with a variety of different symptoms. For example, a person can be very fearful. The person is worried or afraid that somebody or something is going to harm him, something or somebody is going to kill him or abduct him, and the person becomes intensely fearful and stays inside his home, refuses to come out, refuses to go anywhere, even refuses to go to the toilet at night alone. So that may be one presentation. Sometimes people with schizophrenia become intensely suspicious and jealous. They can be suspicious about their spouse, that they are having some extramarital affair. They can be suspicious that their neighbors are trying to poison them. They can be suspicious that their colleagues are doing something to harm him, maybe by black magic or some advanced scientific or automatic techniques like that. So suspiciousness is another symptom like which happens in schizophrenia. There is also another symptom in which people with schizophrenia, they behave certain kinds of odd postures and mannerisms. Like you can see a person standing for in a very eccentric position. Like you can say, say a person standing like this for a long period of time, maybe 1 hour, 2 hours, like that, even more. Sometimes people with schizophrenia, they refuse to talk, they refuse to eat, they refuse to even open their eyes, maintain a very strict rigid position, and when their family members try to touch them, or when they try to ask them what is happening or maybe poke them, they become very resistant and all. That is like catatonia, which is also another presentation of schizophrenia. Sometimes people with schizophrenia, they are able to hear voices. Like to them, the voice is very real. It's a very real voice, which maybe one voice, maybe multiple voices, which tell them about themselves. They can comment on whatever the person is doing. They can discuss about the person among themselves, the voices. They can discuss about the patients amongst themselves, that Mr. So and so is now going to have his tea. Mr. So and so is doing this. Now we will go and kill Mr. So and so. Sometimes the voices can command them that you do this, you do that. Even they can command as to, like, you can jump off the building and you should kill yourself right now. So that is another presentation in which the patients are having hallucinations, mostly auditory, like mostly through they can hear things which are not there, but sometimes they can also smell things which are not there. They can have a smell of very bad, like bad foul smell, maybe of feces or excreta. They can have burning, like smell of something burning, so when nothing is there actually. So that is called olfactory hallucination. That can, the schizophrenia can present with this also. Sometimes they have they can see things which are not actually there. They can see people, they can see their dead relatives in front of them, but this is actually very rare in schizophrenia, but it can theoretically be schizophrenia. Another type is that when it happens in a young age, and that the patients gradually start losing touch with reality. They become self-absorbed. They stay within themselves, alone in a room mostly. They are often found looking at their body parts, maybe fingernails, smiling to themselves without any reason. A lot of the times they can be seen as looking at the mirror and looking at themselves, smiling, making different postures. and making faces at themselves in the mirror and laughing about that without any reason at all. They gradually tend to become irritable or sometimes aggressive. They do not talk normally with their relatives, and they lose their work productivity, functionality, and all those things. So schizophrenia can present with a lot of different things. Basically, to sum it up, schizophrenia is a disease of the thought. Like in schizophrenia, the thought process of the person becomes disorganized. And why does it happen like that? It is because there are certain brain circuits, neurocircuitry is there, certain brain chemicals are there which are not working properly as they should have, and these are usually there is a very strong genetic link to it. For example, a person is born with such kind of malfunctioning circuitry or neurochemicals, and once the child grows up and faces different environments, if there are stressful environment in his or her childhood and later parts as well, the genetics and the environmental stress together combines to give rise to what is called as schizophrenia. So it is basically a disease of the brain, a neurodevelopmental disease which causes malfunctioning of the patient's thoughts. Now we may ask, somebody may ask that what are the early signs of schizophrenia. Early signs, you can see that people in your neighborhood or in your family can sometimes act weird, like talk something irrelevant which is not there actually. They can be suspicious that somebody is trying to plot against him or her. They can be very fearful. Sometimes they can be seen talking to themselves, and there is nothing is there, but the person is talking as if someone is there, but actually there is nobody. So these are very common symptoms of schizophrenia. Sometimes you can see the person is like restricting himself or herself into one's room, refusing to come out, not talking with anyone, not making eye contact, staying in the dark, and behaving very oddly with their near and dear ones. So these are some of the warning signs which people should notice, and they should take these signs very seriously. It is not that these symptoms whichever I just described, if a person is having them, means that a person is having schizophrenia. These are certain warning signs, which a person can be aware of, and if they see these kind of signs in their friends or relatives or family members, they should immediately contact a nearest psychiatrist for a proper diagnosis and management.